Communication Network. Video Rampel here with You Talk. Coming up right now, we'll be talking to Dr. Shivan Mahabir. He's a psychiatrist, and we're talking about vaccine hesitancy. Let's bring him on air. Dr. Mahabir, how are you?
Hi, good morning, Vidya. Thanks for having me. I'm good, huh?
Yeah, and thanks so much for holding on there. Of course, as we mentioned there, this is a regular segment where you chat with us about different issues. You talked about his schizophrenia, I understand, last week with Rishi Harinanan. So vaccine hesitancy, let's get into it now. What exactly is vaccine hesitancy, if you were to give us a definition?
Absolutely. So the World Health Organization defines vaccine hesitancy as a delay in acceptance or refusal of safe vaccines despite the availability of vaccine services. And this is a complex problem, and it is affected by various factors and various contexts. For instance, different vaccines will have different levels of trust among the population, and different segments of the population will view vaccines differently. So this is not a one-size-fits-all problem. This is a very complex issue that affects different people in different ways.
Yeah, it certainly is a complex problem. Why do some people take it, and why do some people do not? So you've defined it for us. I'm sure the research there's a lot of research on it right now. What are some of the reasons why some people are declining to take vaccines in general, and maybe not specifically this one?
So, in general, the issues that affect vaccine hesitancy include complacency, which is where a person feels that the risk of the illness affecting them is very low, or that if the illness does affect them, it will not be very serious. Other issues include confidence in the vaccines. Are the vaccines safe? Were they developed properly? Were they tested enough? Some persons will have issues with vaccines based on religious reasons, because some vaccines were developed using fetal cells, and they may have philosophical or religious problems with that. And there are also convenience issues. Are there sites available where the vaccine can be easily had? Do they have to travel for long distances? Do they have to pay for the vaccine? What is the cost of the vaccine? What are their feelings towards the healthcare system as a whole? So these are some of the issues that affect vaccines in general. And when it comes to the COVID-19 vaccine in particular, some of the issues that have been stated in the research that persons say that, these are things they're worried about, include unknown future effects of the vaccine, long-term effects of the vaccine, potential side effects of the vaccine. They may feel that there's a perception where COVID-19 is less dangerous to the young. There has been poor communication from trusted officials within their community regarding the safety of the vaccine. And there have also been misinformation being spread concerning the effect of the vaccine on a person's fertility and ability to have children.
Yes, those are some of the reasons there. In fact, the last two in particular have been two of the strongest ones. Misinformation is one of the big reasons why. I would suggest in terms of why people are not taking the vaccine. Could you underline for us how dangerous misinformation has been in terms of getting people to not want to take the vaccine?
Absolutely. So there have been reports being spread online and through social media. Two of the most common were one I mentioned already, the problems with the fertility and the pregnancy and the risk of miscarriages. Another one is a conspiracy theory that the vaccine, the mRNA vaccines, which are not available in Trinidad, that they alter a person's DNA. And I can tell you that is absolutely false. No vaccine affects your DNA. And another strange one that people often hear is that they're implanting microchips into persons as a means of mind control or to track them. These are all false, and these have all been very detrimental to the public's trust in taking these vaccines. And then if you have a lower trust in taking the vaccine and you're not taking it up, it allows the vaccine to continue, it allows the disease to continue to spread and develop variants, and therefore the pandemic is continuing without any significant reduction.
Yes, so vaccine hesitancy, we're talking right now about that, and we're chatting with Dr. Shivan Mahabir. He's a psychiatrist, and what are some of the reasons why people are not taking the vaccines. Microchips, very interesting one. I've heard that one before. There was even one suggested, I'm sure if you remember, Fitzgerald Hines, the Minister of National Security, had posted about a friend of his who has died, and he was expressing condolences, and he had mentioned in that particular post that his friend had thought that it was a way of influencing the DNA of people. I'm sure you've heard that particular explanation, which is totally erroneous.
Yes, it is. It is false. And let me point out that claim has been made about the mRNA vaccines, which are the Pfizer and Moderna vaccines, and neither of those are available in Trinidad. But even if they become available, I can assure persons that the technology being used in no way affects your DNA. It does not cause any mutation in your own DNA.
Yeah, and we've seen the memes, haven't you, Shiva? I'm sure you've seen the memes on Facebook and all over social media. There's one popular one where a guy looks like an alien, and he says, well, I took the vaccine and nothing seems to be wrong. And we've seen that. But while they're passed around as jokes, they tend to have an impact on people who may be fearful, don't they?
Yes, that's right, because when these things are passed around, sometimes it's meant humorously with no ill intent. Sometimes it is meant to cause panic or distrust in the community. It depends on the person who's listening, how much they know about the vaccine. That will allow them to decide what is real versus what is not real. And that is why it is very important that our trusted officials are very clear about the vaccine safety, the effects of the vaccine, and the necessity to take the vaccine. So when certain politicians, want to make statements about Trinidadians being used as guinea pigs for a vaccine that has been authorized by the WHO, that to me was scandalous and a total abrogation of his duty to the citizenry, because a lot of people will look to him. A lot of people from a political party will look to him for guidance. And if this is the message that he's saying, it is going to affect, whether people take the vaccine and are able to trust it.
Yeah, and your comments certainly are reflected by the Pan American Health Organization Director, Carissa Etienne, who said in April this year that misinformation is one of the most serious threats to public health. And she's quoted as saying that every person is a vulnerable group that is hesitant to get the vaccine